Do you know someone who has lost loved one and going through grief related depression? Normal sadness is part of normal grief, but sometimes it becomes a lot and it can change into depressive disorder. So, would you like to learn how to cope with grief and to prevent a clinical depression and you can live your best life without unnecessary suffering? Then this episode is for you. Give us thumbs up if you are interested. Welcome to Happy and Healthy Mind. My name is Dr. Rosina, and I have been serving as a medical doctor specializing in psychiatry, a best selling author, and a transformative speaker over the last 20 years. I believe that our mind is the software that runs the hardware of our brain and our body. Therefore, I share practical tips for mental fitness in this program so you can live your best life with hope, health, and happiness. If you are having significant symptoms, please consult your healthcare provider for specific treatment advice. But if you like our content, then join our mission of eradicating preventable suffering and suicide by liking, subscribing, and sharing so more people can live happier and healthier life without burnout and unnecessary suffering. So today our guest is Jill Babiarz. Hi Jill, thank you for joining us today.
Hi, Rosina. Thank you for having me.
Welcome. So Jill is a yoga practitioner for last 20 years who specializes in helping people heal their pain. Through her private and online sessions, she takes a very gentle therapeutic approach to helping you unravel your pain and get your life back again. So let's learn from her. And today, the pain we are talking about is that emotional pain that comes with grief. So, Jill, tell us, how did this topic became important in your life?
Oh, from deep personal experience. So, having lived with depression since I was 15, but not till 20 years later did I actually get help for it. So, suffering for a long time with this underlying depression, and then with the grief of some very significant traumas that brought it up to where it was very serious, and I was hospitalized and I'm in full remission now for 10 years. And so, I've been able to kind of look at that whole time frame and really help people like wherever they are on that time frame of where their grief is at and how that can lead to potentially severe depression.
Yeah, so it seems like people who have risk of depression are at higher risk if the grief comes along.
Exactly. Yep.
So,
Yeah, I think
so
it usually makes it work. Like I was living with it for a long time, and then there came the 5 years of a lot of trauma, and oh my goodness, it came up to this level that I needed all the professionals to help me.
mhm. So let's define grief a little bit over here because, automatically when we say grief, it seems like it's loss of a person, right? Or
Mhm.
loss of a loved one. But it could be loss of any kind. So share with me your definition as you are talking about the grief of traumas.
Yeah. So it can be like going through a divorce is a thing I went through. And that is such a loss and it's such a death. But a lot of times we don't see it that way. Right. And it's easier to look at other griefs of like someone who has passed. And then that seems like, oh, that's more important. But no, something like a divorce or something like ending a long time friendship can also be this level of grief that can become really intense if not really attended to.
Right, right. So it's basically loss of any kind. And sometimes
Yeah.
it could be the loss of job, the
Yep.
loss of body part functioning because of an
Mhm.
injury, loss of your identity because now you're not able to function the way you were functioning before, loss of a relationship, or loss of a significant other. So any kind of loss can result in grief. And then it puts you at higher risk of depression. So tell me, what were some of the tools that, and before you tell us the tools, tell us,
Yeah.
how did your life change when you applied those tools in your life when you were, and how was the life before you applied these tools when you were going through that grief phase?
I would say the life before was so much suffering. Every day was hard, sleep was hard, eating was hard, being in a social environment, it was hard to work, to do my career. So everything was a struggle. and this high level of anxiety and just this constant like physical things not working and mental and emotional. And so I always just say a lot of
Mhm.
suffering. And then going through these different things that have helped me over the years have really helped me get my life back. So now I have a healthy relationship, and I can eat and I'm sleeping, and these day-to-day things that we really take for granted until we go into oftentimes a deep grief or depression, that it can
Mhm.
really affect those things.
Mhm. Mhm.
Yeah, completely changed my life
Mhm.
with getting help.
Yeah, so I'm sure the people who are listening would be interested in learning what kind of practical steps they could take to cope with their grief. So, their depression, if somebody doesn't have depression, they don't get the depression. And if somebody has it, it doesn't get that severe. So, what are some of the tools that you can share that people can apply right away in their life?
Yeah, the three tools I talk about are listening and moving and support. So, the listening in this situation, because you're dealing with grief, is really good to seek out a psychotherapist, right? Or a counselor, someone who is well trained in understanding the different levels of grief and where you might be, and to help you, like before it comes into depression. If you're predisposed, like I was, then it can become serious a lot quicker. And so, wanting to find the right people to listen. So, oftentimes with grief and with depression, people are afraid and don't really understand it. And they think, it can be shame based to go to a psychiatrist or a doctor. Being able to really listen to yourself and the help that you know that you need, and to really honor that, and not to those societal and cultural pressures that we have to not get help, in particular, especially when we're talking about mental wellness, mental health, depression. So this listening piece of really listening to who is going to help you, and finding those right people to help you. It can also be someone like myself who's a yoga practitioner that can help guide you to get additional help that you might need if this grief is becoming too much. The second one with moving is this.
And before we go into the movement phase, I want to understand a little bit more on listening phase. So,
Mhm.
let's say, God forbid, you have lost somebody, and so you're feeling grief. Are you talking about listening to your own mental chatter, which could be too much?
Mhm.
Right?
Right.
Like, mind is going here and there, and all the memories and all the things that you have lost. And so it could be almost overwhelming to listen. So,
Mhm.
in that situation, what do you mean by listening to yourself? Plus, sometimes, especially in situations of loss, even with the relationship loss or a life loss,
Mhm.
everybody wants to come and do a condolence, right?
Yeah.
And so then you're listening to everybody saying, "Oh,
Mhm.
I'm sorry, da 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 da," and it must be hard, and whatever. Different people have different ways of doing condolences. And so you have already lost somebody. How do you listen to your own mental chatter? How do
Mhm.
you listen to everybody else's kind of input that is coming, that could actually help you? It seems like, many times it could actually harm you, or,
Mhm.
it may
Mhm.
hinder your healing process. So, can you
Yeah.
please share your understanding of how to listen? Let's start with how to listen to yourself or your own body without getting wrapped up in the mental chatter.
Yeah. So when I was going through the severe depression and having the suicidal thoughts, it is dangerous to be with your thoughts, right? It's not, I couldn't meditate, and I've been meditating my whole life. And so having to listen to that wisdom and not doing that, and knowing so what's coming to mind to me is to listen to what you need. So when you have all these people doing condolences, that you are able to find a therapist you can trust, You can find a support group you can trust. You find a place that you can go, and the boundaries also of like not being around all of the people maybe that are doing the condolencing for a long amount of time, so that your energy is preserved, because that can be really draining and exhausting, and then it makes you think about it the whole time. So if you're able to find a therapist who can give you some other tools, or a support group where you can really be heard, and a therapist would often take walks with me. So we would walk in the arboretum and we would talk about where I was at, but we were out in nature. So it was like a break from the depression, a little bit from the grief. And at the same time, I'm healing.
That's wonderful. Yeah. You remind me of a tool that we use sometimes in terms of when you are okay. So our brain has different level of consciousness, right?
Right.
At a certain level is the monkey brain, which is kind of da 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 da. And if you're depressed, then it will be more negative chatter. And so, and if you have lost somebody, it would be kind of in that phase. So there could be a lot of negative chatter. So that is a level. And then there's a higher level of consciousness. And sometimes if you just can access or make an intention of observing your thoughts,
Mhm.
then you can actually notice, your higher brain can actually notice that your lower brain is doing this mental chatter.
Right. Right.
And as soon as you engage that higher brain that is observing the lower brain, that lower brain loses hold on you.
Mhm.
And so, like you said, what do you need? Ask yourself, what do you need? That question is asked by the higher level of brain,
Exactly.
saying, okay, well, my lower brain is right now jumpy, and it is okay. And
Yeah.
I need to be kind to myself.
Mhm.
I have just lost a relationship, or I have lost a person, or I lost a job, or I have lost something. And it is normal to feel that grief, that sadness. And so it is okay. And I'm feeling it. And so just kind of being in that moment, acknowledging that it's okay,
Yep.
observing that it is happening,
Mm.
and then asking what is going to help me in this moment, or what is the best thing I can do in this moment. And then it may be the answers may come as, okay, going for the nature walk may help you,
Mhm.
or taking a really relaxing tub bath may help you,
Yeah.
or a warm shower may help you, or
Mhm.
listening to music may help you, or writing may help you, or talking to a friend. So different people have different ways of coping with difficult situation, but having engaging that higher brain which observes that what is happening at the lower brain level, and acknowledging and identifying, is something that could help a person in that moment. So
Mhm.
listening to yourself could be, observing. Listening is a way of observing, right? So
Mhm. Right.
observing yourself in terms of, okay, this is what my mind is doing, this is what my body is doing. You may feel
Right.
like your body is really tight and it needs to relax, or your body is really hyper and you're jumping from one thing to the other, and you're drinking more coffee, and so it's making you more jittery. and, and so kind of acknowledging and noticing that, okay, my body is exhausted, I have been up for 2 3 days, I really
Mm.
just need rest. And
Mhm.
so listening to the body could be observing and
Mhm.
becoming aware of what is happening in your mind, in your body, in your soul, in
Yeah.
your circumstances, and then picking up what is the best thing in this moment that I can do, and take the action.
Mhm. And it's nice, when you're talking about the higher brain and the lower brain, it's like make those resource lists from the higher brain moments. So when you're in that place and you realize, oh, this might help me, or this might help me, all the things you said, bath, or who could I call, or what, I could take a walk. Because in the lower brain moment, we forget. because it's the monkey is going, and we're going through depression, grief, and we forget who can help or what can I do. And if you can just look back at that list and realize, oh, that's right, I could just go take a bath, that might help. So it's really helpful because the brain it's hard to focus when you're in those places.
Right, right.
So then you have a list and, oh, that would really help. I do that to this day myself.
Uh-huh. So you have you call it resource
My
list.
Yep.
I call it
Mhm.
deposit list. So
Ah.
yeah, so uh, when my Stress to Joy book came out, one of
Mm.
the concept that I talk about in Stress to Joy system is called emotional coping account. So
Mm.
like everybody has a bank account, they have withdrawals and they have deposits, right?
Mhm.
What happens if the withdrawals are more than the deposits? It
Right.
goes negative, right?
Right.
And
Yep.
so what you do, you try to increase the deposits and decrease the withdrawals. So similarly in life, everybody has their emotional coping account. All the withdrawals are things that make you feel
Mm.
negative or bad. So grief is a huge withdrawal,
Yeah,
right?
absolutely.
And then deposits are all these resource lists that you talked about, things that helps you, uplift you, expands you, increases your ability to cope with the
Mm.
situation. And so when you realize that your balance is going down, you need to
Mhm.
increase the deposits to bring it up again. And I always talk about, keep depositing regularly. People who are financially savvy, what they do, they don't wait for the big crisis to happen. They keep saving every
Yep.
day, every day, every day, every day. So their balance is higher. So when there is a big withdrawal, they are able to handle it without collapsing. So I would advise people to either call it a resource list, like Jill calls it, or call it a deposit list, like I
Deposit,
call
yep.
it. Then make that list ahead of time. Don't wait for
Yes,
things to happen. So
exactly.
in my phone, in my to-do list, there is a deposit list task.
Mm.
Okay, and in that, all these things are what are my deposits. So when I'm kind of feeling down, I pull it, okay, what is my deposit I can do? But every morning when I'm looking at my to-do list, I'm also checking, okay, what is the deposit I'm going to deposit in my coping account today?
Wow, that's really neat.
That's wonderful. Thank you for sharing about the resource, listening to the body. So let's move to the second step you had said was movement. So how
Mhm.
does the movement help grief?
So in my practices, we talk about embodying these feelings or these emotions or these events that have happened in our lives. And so I'm oftentimes I'll have someone, they'll be lying on the ground with me or they'll be sitting in a chair, and what will be brought up is maybe this certain grief that they're working with. And listening intuitively, going in and asking, what does my body want to do with this? If I'm going to ask myself to move, what might that look like? And I always do this when I'm doing my interviews, because I will sway with them and they'll sway with me. And all of a sudden you'll notice they'll start moving their leg, so certain things, because something's holding in their pelvis. And so same with grief, there's a heaviness that comes with that. And so when we can start moving the grief, instead of it maybe being stuck in a certain part of our body, or that we think we will never heal from that trauma that happened, I'm here to say you absolutely can. I've healed from many. And you can come full circle with this gentle therapeutic movement can really help your body start to process. So it's not just all up in the head and the thoughts and the emotion, but the body can start moving, and then the nervous system starts to shift, and you can see, much more progress in your healing as you work with grief and depression.
Wonderful. I have seen that people, when they are in grief, they feel stuck.
Yeah,
They don't feel
absolutely.
like doing anything.
Yeah, exactly.
And
Yep.
sometimes they're curled together,
It's
right?
yeah.
They're closed, they're
Mhm.
curled, they kind of want to
Mm.
save themselves. And so it's okay to
Yeah.
go into that phase to make yourself safe. But
Yep.
after, you kind of calm down, then you need to realize that the more you would stay stuck, it would stay within your body. So you want to let it go. So any kind of
Mhm.
movement, any kind of breathing exercises would help you let go of that grief and allow you to move on. And sometimes you
Mhm.
don't want to move on, you kind of feel
Yep.
so stuck in that feeling that you don't want to move on. You want to stay stuck because that kind of keeps you close to something that you loved. whether it was a relationship or a job or a loved one. And so you want to hold it and you don't want to move.
Mm.
How do we resolve to the point where like we are ready to move? So when your clients are feeling that stuck, how do you help them to feel motivated or have the desire to actually move?
Yeah, so what I do is first really meet them where they're at. So if they need cocooning, is like what I feel like you were describing, where I will wrap them in a blanket. So they might go in
Mm,
child's pose and I'll put a blanket over them or lie them on my therapy table. And then they are cocooned and they're meeting themselves where they're at. So they're meeting this big loss, and that it's real and it's there and it's being acknowledged. And then can we bring a little movement out of that place? Like, can we start to just move one arm out of this enclosed in protected, like, intelligence of the body with what you're going
mm,
through? Can you
mm.
slowly move one arm? Can you slowly just turn your head to the right and left? And it's amazing by with the smallest movements, how someone will feel something shift and they recognize, oh, I don't have to maybe keep holding that in my neck. So I meet people where they're at and keep them supported. So keep them wrapped if that's what they need. And then very slowly letting them know, like you said, it's okay where they are. And even the littlest things matter. So the little tiny movement of an arm, of a leg, the little tiny walk around the block. Something can be very small, but it can be so pivotal when you're in that heavy protective place.
Right, right. Yeah, so people who are not able to see you, not everybody would be able to see you, they can also use this principle of reaching yourself where you are.
Yes,
And if
yes.
you do need to have that cocooning, use different ways of cocooning yourself and allowing yourself until you feel ready to take, move that hand a little bit or face a little bit
Ah,
or a breathing. I learned
yes, yes.
a expanding breathing exercise
Mhm,
from Marcy Shimoff. I was
mhm.
hearing Marcy Shimoff one time. And so she was talking about this embracing while you are breathing in and out. So you can, when you're breathing in, when you're kind of feeling like this, you breathe out.
Ah, nice,
And then you
yeah.
breathe in while expanding. And so
Ah,
you can kind of open up your chest and then breathe in. Like, yeah, breathe out when you are kind of cocooning
yeah.
and breathe in.
I'm raising twin 3-year-olds right now, and they
Uh-huh.
have what's called a breathing ball from their
Uh-huh.
therapist.
All
And it's
right.
those, because they're 3, so how much
Right.
attention span do they have? But like they take this breathing ball in what we call our safe space in our home. And that's exactly what they do. They open the ball and they inhale, they close the ball and they exhale. So they'll go get the breathing ball. And I'm sure therapists have used this with adults too, where it's something where your focus goes somewhere else and there's the breath, but then you're doing a motion with the breath.
Right.
It's
Right.
lovely.
Yeah. So you're combining the motion with breathing,
Yeah.
with, bringing in that openness rather than the closeness.
Yeah.
It's
Hmm.
wonderful. So you talked about listening, then you talked about moving. What about the support? How do a person who's going through the grief create the support? And again, if you can mention in terms of the helpful support versus harmful support.
Yeah, exactly. I was talking about the boundaries earlier. So walking through depression myself and, severe enough to be hospitalized, that was really a challenge to hold those boundaries, to notice like, and this could be for me, like it was a close family member that wasn't supportive, right? So you're going to someone who you maybe have been supported with in other circumstances, but that they are not able to support you in this place of deep grief and depression. So you're finding the right friends, the right people who, can help, can listen, can hold space and really understand, and that aren't shaming you or blaming you or telling you don't go get help. I was in the ER multiple times before I checked in, and I had a family member say, "What are you doing there?" And so those would be the people that you kind of want to, set boundaries with and stay away from at that time, and then go towards the people that will listen and will support you and will help you find a therapist, will help you find a support group, will help you find your way to the hospital if you need. So finding those people that listen and understand and acknowledge and honor that what you're going through is very real and very heavy and very intense, and there is so much help available. So just navigating that and finding your way. So as a yoga practitioner, people will come in, and again, I will help them create their teams around this grief, like who is helpful and who isn't helpful. And you have to be really, aware that you're choosing who is helpful on this healing path.
Wonderful, wonderful. Well, we're coming towards the end of our time. So, can you kind of summarize all the tools that you said? Like, what would happen if people do apply these tools? What would happen if they don't apply? And if what's your take home message today?
hmm So, not applying them, we're staying in suffering. Especially with depression and grief, it oftentimes will just get worse. And so getting help as soon as you can is better. But life is not very fun when you're staying in that place. Everything is heavy. It's really hard to have relationships. It's hard to sleep. So many things aren't going so well. So when you get the help, when you get the support, and you get the right resources around you, then your life is back again. Then you're able to sleep and eat and work with some of these daily functional things that then can take you back into, okay, now you can work again. Now you can be with your thoughts, but be with them in a safe way. So my take home is just that you really honor yourself and where you're at, and find the people that you connect with, the movements that you connect with, the therapists that you connect with, because they're out there. So trust that they are out there. You may have to go through some, right? But that trust that the people are there to help is available, and that you don't have to continue to suffer. No matter what traumas or grief, depression levels you've been in, you can get it. You can get to the other side, and life can be pretty amazing again.
That's wonderful. Thank you so much for sharing your wisdom. And so, if people want to hear more or learn more from you, how could they do that?
So healingwithjill.com. Hop on there and you'll get a 10-minute free meditation video from me that is very helpful with the things we've been talking about today, walking through these different layers of healing in your body, especially when you're feeling the grief. And then also you can book a connection session on there with me, which is 30 minutes free, where we share our stories and I see if I can help you heal your story.
Oh, wonderful. And Jill has been gracious enough to also share a gift with us, a Happy and Healthy Mind group. And it's a 6 simple exercises to heal your back. I hope if you guys want to do that, just hop on to happyandhealthymind.com and look for the resources, and you'll find all the resources that we share in these programs. And if you would like to get a text reminder for future programs or the links to these resources, just text the word joyful to number 38470. So we would be happy to send you those reminders and resources link. And so now it is time for the special of the day, because we have been talking about grief. A lot of times I get this question, and when should you use medication? People ask this question because sometimes they're not sure if their grief and if their depression or if their anxiety is severe enough to need the medication, or they should stick with counseling or therapy or other kinds of approaches. And so let me try to answer that question for you today. If you're interested, stay with me so you can decide what level of care you need. All right. So depending if you should use medication or not depends on the level of symptoms that you're experiencing. Let's say if you are having some symptoms like some problems with sleep on and off, some problem with anxiety on and off, but you're not having severe symptoms, then you can use a lot of relaxation exercises, self-help, mind training to help you get through that phase. Let's say if you are having more significant symptoms that you're not able to get better with self-help work, then seek out therapy. work with a counselor, work with a psychotherapist who can help you get over those mental obstacles that may be preventing you from getting better. If that is not working, or if even if it is working, you may need some support of, let's say, some herbal supplements, some natural supplements. Somebody's going through grief, they are working in therapy on the grief issue, but their sleep is disturbed, and maybe having a natural remedy like using magnesium, or using melatonin, or GABA, or L-theanine, or there are different type of herbal supplements that are available that may help you sleep better until you are able to get through the psychological obstacles that you're facing. There are times when symptoms are really severe. You're really into severe reactivity mode, severe anxiety mode, severe depressive mode. Your sleep is totally disturbed, and so you're in severe depressive phase. And trying to work in therapy is really hard at that time, because you don't have the energy, you're not able to sleep. And in those situations, it is okay to take medication. It is okay to see a medication provider who can give you the medication, choose the medication with least amount of side effect, with highest and least risk of, let's say, dependence. Because that is another question that people have: what if I take a medication and it makes me dependent? Because there are some medications that can make you dependent, right? So you want to work with a good provider who can walk you through, have a plan. Okay, this is the amount of medication you should take. You should not take more than this, or not longer than this, otherwise your risk for dependence increases, and help you through that phase. So help you taper down at the appropriate time, while you're working in therapy, while you're developing your mental resilience. You can use the medication to decrease the severity of symptoms, so you can come out of that dip and be the best self you could be. And so I hope that answers your question. If you have any further questions, please feel free to send me the question by hopping to happyandhealthymind.com and send us the questions, and I'll try to answer in future programs. At this point in time, I leave you with the question: what do you choose? Are you going to choose to allow the circumstances to lead your life, or are you going to take the lead of your life? Every day is a new day. Every day is a new choice. You have the opportunity to choose whatever your response to your circumstances is. Circumstances are not in your control, but how you respond to them is in your control. Make wise choice every day. Stay safe and healthy. Until next time, Dr. Rozina.